Hi guys, welcome to Work For It Wednesday with Flux Strength. This is week 7. Today we're going to talk about tibial internal rotation, how we can assess it and what we can do on our own to try to fix it. For some of you guys, you might be having some knee pain with your deep squat. This could be the answer to figuring out what we can do to solve that mystery. So we're going to start off with doing a quick assessment with Tyler. We'll go over some things that we can do on our own to fix this issue, and then some partner assisted drills that we can do as well. So to start off with, for the assessment, what you want to do is find something you can sit on that's going to keep your hips about parallel, if not a little bit lower than your knees. And then from there, if we can get a bird's eye view, what we want to do is kind of see, have his feet pointing straight forward from the kneecap. And then all he's going to do is stabilize his knee. So go ahead and grab both sides of your knee there to kind of stabilize the femur from moving. And then what you want to do is externally rotate your foot with your tibia. So kind of bring your foot out like this as far as you can, and then now bring it in as far as you can without lifting your toes off the ground. So go ahead and do that one more time. Nice and smooth, yep. And then come in as far as you can with keeping your toes nice and flat. Good. So yeah, ideally what you want to do is you want to have about 20 degrees of internal rotation there, so you can go back to neutral. You want to try to get your pinky toe to cross the plane of the tibial tuberosity there from that ridge. So go ahead and do the other one here. The reason we stabilize the knee is because we want to avoid any hip activation to kind of isolate the tibial rotation. Good. So common mistakes, go ahead and do that one more time. Common mistakes with this assessment would be lifting off into inversion in your foot. So yeah, we're looking for that 20 degrees. So on his right side, there's a little bit less, but still he's in pretty good range. So we'll kind of show you some things you can do on your own to fix this. So go ahead and stand up, Tyler. So the first thing you can do is the leg that's got the limited range, you want to put it on top of the bench. And then just kind of traction from the outside in for some internal rotation of the tibia. And then you just want to track your knee over top of your foot, just like that, yeah? And then come back. So you're kind of going into knee flexion and then letting off a little bit. And you're going to do that, pump that back and forth about 10 times. To add in a little bit more traction, what you can do is you can grab self-mobilization band. So you can grab this and basically just start from here and kind of wrap it up towards the top. What this is going to do is just give a little bit more traction and a little bit more support when he's doing the drill. And then just kind of end up right over top of that tibial tuberosity again. So then you can do the same thing, just kind of traction into internal rotation of that tibia, and then track his knee over top of his toes. Good. So what we can do if you've got a partner, you can go ahead and take that off. If you do have a partner, what you can do is there's a couple different things to make it a little bit more dynamic. You can start this exercise in an open chain. So if you have somebody that's getting a lot of pain in their knee, you can start it into an open chain. So go ahead and lay on your back. Yep, on your back, yeah. Or on the bench on your back, sorry. So you can start off in an open chain. Basically what you want to do with this is keep their knee into extension and then do the same thing, internally rotate that tibia, and then just bring it into flexion. At end range, kind of pause, and then you can come back into full extension, holding that internal rotation the whole way through. And this is just going to help to mobilize that tibia to gain some more internal rotation. You can come on up. After that, if they're pain-free with open chain, you can do some more closed chain exercises. So come on over here and you can go into a squat. So a lot of times, a couple faults that we'll see is when people go into a deep squat, if they do have internal rotation issues of their tibia, their toes will kind of creep out at the bottom, or they might get knee pain on the outside or even some hip pain. You can go ahead and stand back up. So if you're seeing any of these things, you might have an internal rotation of the tibia issue, so you want to do an assessment. So something that you can do with the partner is get them to stress that internally again and go ahead and drop into a squat. Good, and come back up. And you can kind of just track that, holding that tension the whole time in the closed chain. Do it one more time. Good. And if you want to make this a little bit more difficult, you can add a little bit of resistance. You can just put this around your right knee, just above your right knee. Basically what this is going to do is going to add in a little bit of the external hip rotators and the adductors for the right hip to kind of build up this whole hip and knee complex. So go ahead and do that same thing with the internal rotation. Go ahead and drop into a squat. A lot of times athletes who have restricted internal rotation of the tibia will also have right hip issues or trouble activating that right hip. So this is something you can do to kind of correlate both together and make it a little bit more dynamic. That's all we got for today, so hope you guys learned something. Thanks for tuning in, and stop in next week for part 4 of our knee stability series.